Hi, and welcome to this Wash Fit module about inclusive and empowering wash in healthcare facilities. My name's Chelsea Huggett, and I'm from WaterAid Australia. And I'm going to give you a really quick overview of what's in the Wash Fit training module that we've just developed about how to make it more inclusive and empowering of different people. In the module, you'll learn lots of things about understanding who is marginalised and why, getting some knowledge of how to improve participation of different users of healthcare facilities, thinking about and understanding some solutions to make WASH more accessible and inclusive in those settings, and understanding how it fits with WASH Fit, what the relevant indicators are, and how to measure those. So let's get started. As a first step on inclusive and empowering WASH in healthcare facilities, we really want to know and understand who's marginalised and why are they experiencing that. All kinds of different people use healthcare facilities, and during their time there, they need WASH as part of essential services. Women giving birth, women who are menstruating, infants and children, older people, people who are really sick or frail, people with disabilities. It's such a diverse group of people using healthcare facilities. So whenever we're doing WASH improvements, we need to really make sure that we're making it as accessible and open to everybody as possible. So the definition of this area really is about being people-centered. In healthcare facilities, we want to be thinking about the physical accessibility of the WASH services and facilities. So for example, how easily a person can use a toilet. But we also need to be thinking about the socio-cultural aspects of accessibility. So thinking through security and privacy, how safe does it feel to use a bathing facility? How easily can someone do it independently and with comfort during what's usually a really vulnerable time in their lives? Poor WASH in healthcare facilities really does impact people differently. And often if a person has another factor in their life which means they experience discrimination, they may have more difficulties accessing WASH when they're in a healthcare facility. Some of the factors that can impact people's access includes disability, age, a person's gender, their sexual orientation or gender identity may create more challenges. Of course, poverty intersects with all of these factors and can be a critical reason why a person can't access WASH in healthcare facilities. Ethnicity, Indigenous groups and caste can also play a role. So we'll learn more about some of these factors and why as we go along. In the module, it takes you through a really deep dive into what inclusive and empowering WASH looks like. Components such as having safe, private and well-lit facilities, making sure menstrual hygiene needs are met, making sure it's accessible to all users and meets the requirements of people like caregivers and parents, ensuring that women who are giving birth have got the right WASH services and facilities they need both during labour and after birth. And of course, staff working at healthcare facilities, as we know, majority of healthcare workers are women who also menstruate at work and who also need safe and private facilities. But a really critical part to all of this is making sure that the teams and the decision-making processes themselves are inclusive and empowering. So with every step we take, we need to make sure that there's diversity in decision-making. A really good way to do this is to partner with organisations of people with disabilities or women's rights groups, or perhaps education groups or Indigenous groups who can help to consult and to advise on what it's like using WASH services in a healthcare setting. Having a set of principles or ways of working to give everyone a voice is a really important step, and always aiming to have a gender balance, an equal gender balance, is important. Also recognising that staff working in these spaces will have very different WASH experiences, and getting their perspectives from cleaners to nurses to doctors is really critical. And of course, last but perhaps most importantly, healthcare users themselves, particularly women who've delivered a baby at the facility. Getting their perspectives about their WASH experience will provide absolutely valuable information. So from here, everything we do is in a really participatory way. So we're going to look now at how we do assessments of the barriers to WASH in healthcare facilities. So a barrier analysis is a practical and participatory tool that can be used in many ways and at all levels of the WASH and health systems. It can be done as part of WASHFit, making sure that as you're recording WASHFit assessments, you're also looking at the barriers to WASH for different groups. It's a really great way to raise awareness across staff, and it gives voice to the diverse users. It's a really fun training tool as well to use with different stakeholders. In the module, we go through it in a lot more detail, but for now, please note that there's 3 different types of barriers: physical barriers, policy and institutional barriers, so that's guidelines, policies, and of course, social and cultural and attitudinal barriers. And all 3 are absolutely critical to address to make sure we're being inclusive and empowering through our WASH work. So taking action. What are the practical steps to improve WASH facilities and WASH outcomes in healthcare facilities? One of the main ways to do it really safely in an empowering way is to ensure that maternity wards are prioritised. Getting to WASH facilities can be difficult for some people, so making sure they're centrally located, the pathways are clear and wide, and that there's handrails and clear signage are really good components to address. Other features getting inside the facility include sex segregated, making sure that they're well lit, lockable, and that there aren't any gaps where people could see through. This is particularly important for the gender equality aspects of doing inclusive WASH. For people with disabilities or people who might have difficulty walking, having really wide doorways, outward swinging doors, and ramps are really critical as well. And then inside the latrine or the WASH facility, making sure there's enough space for a person to maneuver a wheelchair or have a support person there. Handrails and toilet seats are really critical, as well as making sure there's water inside for cleansing. Easy to use taps, bins for disposing menstrual materials, and hand washing facilities at a low height. Just to touch on menstrual health briefly, this is a really critical part of the module, and we look at the key components of that as part of the full module: access to information, access to menstrual materials, making sure the WASH facilities and services meet these requirements, and then of course, decision making at all levels. And just to note that we can do simple and low cost improvements, and that these can be a really great first step. If there's not the space and budget yet to do a full inclusive and accessible improvement, then start with some really simple and easy low cost improvements. Handrails, temporary toilet seats, putting a bin inside the toilet to use for disposal of menstrual materials, ropes to guide someone along the path, or simple signage outside a toilet to show which ones are male and female. These are really critical first steps that can be done with some very simple consultation and engagement across healthcare facilities. So that's a really brief snapshot of the module and what it contains. Just to recap on some of the key messages that we've shared today: nothing about us without us is the mantra around including different people. Recognizing that some people will experience marginalization and exclusion from WASH in healthcare facilities, and that it's our job to make sure that we reduce those barriers. Also remembering that the barriers can be social, physical, or institutional. And remembering that WASH solutions really need to be accessible, safe, private, and comfortable for all users of healthcare facilities. I really look forward to seeing you as part of the module.